News is committed to your health. January is Cervical Cancer Awareness Month. University of South Alabama Health System says more women in the U.S. are treated for pre-cancer of the cervix than for breast cancer every year. Joining me now to talk about Cervical Cancer Awareness Month is Dr. Jennifer Pierce from the Mitchell Cancer Institute. Thank you very much for joining us today. This is a sort of a silent cancer that creeps up on people sometimes, and then it's too late when they discover it.
Absolutely. Thanks for having me. I am excited to talk about it because it is one of those cancers that people think they could never get. Even if they get their screenings on time, unfortunately, some women still get cervical cancer despite regular screening. And for some women, that last pap smear before the pap that diagnosed cancer was normal. So we have to do more.
So that's why it's important to stay on schedule, not to say, oh, I feel good, I'm going to skip a year.
Correct. So the years may vary, different recommendations for different patients. So we ask patients to check with their doctor about their specific recommendations. But yes, to stay on schedule with your screenings and to add, for women over 30, to add to that pap smear an HPV test. Because an HPV test will do more to find disease earlier than a pap alone. Okay,
now we talk about getting vaccinated. This is, I'd say, within the last maybe 10, 15 years, a recent development. When should women get vaccinated?
So first, I want to say exactly like you said, the vaccine has been FDA approved for 11 years now. It's been in development for 20 years. I wouldn't consider that recent. You know, I want people to know that this has been around for a while and it's really time to get on board. So you get vaccinated as an adolescent, ages 11 and 12, as a routine part of other adolescent vaccinations, including meningitis and that Tdap follow-up. So for adults, you actually can get vaccinated up to age 26. So for anyone out there who maybe wasn't vaccinated as an adolescent, can get vaccinated all the way up to age 26.
Okay, and then after that, you just have to rely on screenings and checks and things like that?
Correct.
Now you've got Science on Tap coming up. You talk about that.
Sure. So as the leader for cancer prevention and control, we're really trying to not just talk about cancer prevention, but what the science behind cancer prevention is. When I started in this work, raising awareness about cervical cancer and the HPV vaccine, I was told that it wasn't science. And we actually find that the science of changing people's behavior, getting people to get vaccinated, to get pap smears, how do we get more people to do the right and healthy thing, is a valid science. And we'll talk more about it at Moe's Barbecue.
Oh, sure. And that's coming up 6 to 8 p.m. on January 18th.
Correct.
Correct. And you're wearing teal because teal is one of the colors that you use to promote awareness.
That's exactly right. So teal and white are the cancer colors for cervical cancer, and we're inviting everybody to wear teal on January the 12th, which will be our Teal and White Day. We'll be decked out in teal at MCI and across USA, and the RSA towers will be lit up that night, both in Mobile and Montgomery. So,
and you're a recent sort of, like, you've just come to Mobile in the past 2-3 months, you said?
Correct.
And you get to practice and do research at MCI.
Yes, I'm 50-50, which is really just takes my passion and makes it my day job.
Oh, perfect. Thank you very much, Doctor, for coming in. We appreciate that. Hope everybody decks out in teal.
We'll see you then, all in teal. Thank you.
All right. Thank you very much.